Couple of preliminary matters. First of all, Mr. Chairman and Mr. Ranking Member, thank you for having this hearing, and I thought your opening statements set the right tone. What is it in the market that's broken that is causing these prices to be increased? Also, Mr. Heiss is asking about whether there's something we can do with the FDA and the approval process. I'm all in if there are things we can do that won't compromise safety. Second, full disclosure, Mylan has an excellent production facility in St. Albans, Vermont. Many Vermonters work there and very proud of it, good wages, and it's a good employer. And then third, what drug companies do, I totally agree, is vitally important. You know, my first wife had cancer, 9 years, and medications extended her life and alleviated her suffering. So it's important that get it right. But here's the dilemma, and it's best summed up by a letter that I received. We all got a lot of them from a person in Essex Junction. My 4-year-old son has a severe peanut allergy, and I'm a single mother working a low-wage job with little health care coverage. I can't afford to pay this much for EpiPens, and I can't afford not to because that cost is possibly his life. So the heart of the matter here is that moms and dads are being given a Hobson's choice. They can pay more than they can afford, or they can risk a loss they cannot endure. And that's why it's so urgent that we work together to get to the bottom of this. And I want to focus my questions on some of what I think are the market breakdowns for lack of competition. And again, Mr. Heiss, I acknowledge the FDA, maybe we got to make some reforms there, but there's some things that are happening. When your company bought the EpiPen, the company and got the EpiPen, that was in 07, I think, right?
Yes.
And how many EpiPens were sold then?
Much less than today. I think it was, it was certainly less than half.
Probably way less than half, right? I have a question about the basic economics. Usually when you sell more of something, the per unit cost goes down. Is that not the case with EpiPen?
So no, cost of goods has gone up every year, and our investment has continued. We've continued to invest in the product.
So you're going to give us, you'll give us the figures on that, because I understand you're saying it's $50 that is the money in your pocket, which sounds like it would be reasonable. But as you can tell from a lot of the questions, there's a lot of head scratching going on here about that.
I totally appreciate that, and I appreciate there's been a lot of misinformation, understandably so, given the complexity, as many of you have pointed out, in the system.
Well, I'm going to ask you to get your graph out that you gave us, sure, where the wholesale acquisition price is $608. That's what people are paying. Yep. And then you got down to the bottom, it's $50 for the profit per pen.
Yes.
That $50 sounds reasonable, but the rebates and allowances, who's getting all that money?
So that is between the other people in the supply chain, the pharmacy benefit managers, retail pharmacy, okay, wholesalers,
isn't the service
and insurers.
Isn't the service that a pharmacy benefit manager provides essentially to negotiate a best price with the pharmaceutical companies to get a given drug? And they get a rebate, right? Probably
be better to have a PBM, but philosophically, I think that the pharmacy manager, the system, that is...
No, but I'm not talking philosophically. We're all trying to understand, like, how it works. So the PBM buys huge quantities of drug A, B, or C, and then they get a discount from Pfizer or from you, and they keep some of that, and it's the way they make their money. And part of their way of negotiating is with a so-called formulary, right? So if you have heart disease, there might be an option of drug A, B, or C, and they put on the formulary drug A, and there's increased volume there, and they get a rebate, right? Mm-hmm. With respect to epinephrine, there's no formulary. If you're having anaphylactic shock, there's only one thing you need, and it's the product that you sell.
No, there has been competition, as we've said throughout the years.
All right, but
I think
not-
this is, if I only could just get this point, AVQ, which launched their product at the end of 2013. So we did have to face formulary choices of not even being on the formulary due to the competition in the marketplace.
But somehow you've ended up with 94% or 97% of the market.
But I would ask that people recognize our product and that it is more complicated. AVQ was completely recalled off the market for safety reasons, which is a very rare event.
No, I understand that, but in this graph, I mean, what is just impossible to understand is how does something cost $608 when the company that sells it is only making $50, and that is hard to understand.
And I understand how complicated and how head-scratching that is, which is why, I've said I would welcome the opportunity to sit down. I know this is about EpiPen, but look at the system.
Time, so I'll have to keep going. This is hammering that Vermonter who has that Hobson's choice, but it's also very tough on taxpayers. Our Medicaid program in 2011 was paying $111 per script, and we spent in Vermont, and this is a lot of money for us. We spent then $111. Now it's $557. We went from $256,000 of taxpayer money to $1.7 million. That's tough. I mean, it really is tough.
And look, and that's why the generic, being able to put it into the market, that would help lower healthcare costs across the board.
Right, but the generic, what I understand, it used to be the position that you had, Mylan had, is that doing these authorized generics was a real threat to the generic industry. That's the public record of your point of view.
A decade ago, and I know that this is complicated, but the authorized generics of keeping a first generic or competing with the generic, in this instance, that's not this case, but
if I can just go on a little bit, one other thing. The cost of EpiPen in the Netherlands is $105, and that's where your corporate headquarters are. How do they get $105, and you moved your headquarters from the U.S. to the Netherlands? How is it they get to buy it for $105, and we pay $608?
Sir, I'm not sure of the cost, but what I would say is they have a completely different system.
I guess I yield back.
We would appreciate some clarification on that.